Hello everyone, welcome to my prevention clinic at Save a Life Health Tips. So today we're going to be talking about hepatitis. So could you have hepatitis and you don't know it? The answer is yes. So before we continue, let's talk about hepatitis. Now imagine your liver, the hardworking detoxifying life-saving machine inside you, getting inflamed, angry and ready to quit on you. In fact, basically saying I'm done with you. That is hepatitis for you. And guess what? There are different types. We have hepatitis A, B, C, D and E. But for today, for the sake of time, we'll be talking about hepatitis A and B. In our next video, we'll continue from hepatitis C. Now briefly, hepatitis A. Hepatitis A is an acute hepatitis. That means it is short term and it does not cause any serious liver problem. But it is highly contagious, yes, and can make you very sick. And it is basically gotten through fecal oral route, through eating food or drinking water that is contaminated with this virus. So I will make an example for us. Most of us go to the market to buy our fruits like our oranges, our watermelon and all of that. So most times we will ask the seller to help us peel these oranges or peel our fruits. On our way home, we'll start eating them without washing them. So by doing that, like eating your fruits, immediately you buy it from the market without washing them, you are indirectly exposing yourself to hepatitis A. And most of these sellers, they don't have time to wash these fruits. Then they will sell it to you expecting that you will wash them, but you will not wash them. Also, if for example this seller has this virus, this hepatitis A, and probably the person went to the toilet and they didn't wash their hands, they will sell this oranges for you and even help you to peel the orange. So basically you'll be exposing yourself to the virus hepatitis A. And also, before you think of buying food from the market where everyone will be saying, "Mama, give me rice, Mama, give me beans, Mama, give me plantain," you should consider thinking twice. Now, hepatitis B. Hepatitis B, hepatitis B, hepatitis B. Well, why am I shouting hepatitis B? This is because hepatitis B is a master of disguise. You could have it for years and not even know it. Meanwhile, it is there quietly and silently damaging your liver. And this can lead to liver cirrhosis or even liver cancer. But here's the kicker, it is preventable and that is why we are talking about it. But first thing first, mode of transmission. Like how is it gotten? Like how is this virus being spread? One, through blood, e.g. like blood transfusion. Secondly, through unprotected cells. Yes, through unprotected cells. Also sharing of needles and razors, and even through unsterilized tattoo equipment. Yes, hepatitis can be gotten through unsterilized tattoo equipment. So if you are planning to get one, you should be careful. But if you already have one, you should go check. Then lastly, from mother to child during childbirth, and that's why it is important as a mother that when you are pregnant, you go to the hospital for a regular checkup. So if peradventure you have this hepatitis and the doctor finds out, they put you on medication and you give birth to a very healthy child. Yes. What are the symptoms of this hepatitis? What are the symptoms? What are those things you start feeling? What are those things you start seeing if you have it? One, dark urine. Yes, your urine will be dark. You have this color-colored pale. Extreme tiredness. You just feel tired unnecessarily. You feel stressed up unnecessarily. You have loss of appetite. You don't want to eat. You don't feel like eating. You have stomach pain, especially in the right side of your stomach where your liver is. You have fever and body aches. You just start feeling this body pain all the time. Prevention. How do we prevent this hepatitis? First, you see those mode of transmission I listed. You have to be careful with them all, and also try as much as possible to be smart, be clean and get vaccinated. Vaccination will be emphasizing on it in our next video. I'm aware that most of us are good at self-diagnosing, yes, but those symptoms listed can also be as a result of any other disease. So the best thing you can do for yourself is to go for checkup. You see a doctor, not only because you're having the symptom, but because your health is important to you and you want to be free from any disease that is good at disguising. In our next video, like I said before, we're talking about hepatitis C and we're talking about vaccination if you've not yet gotten the vaccine. But before then, for the love of science, practice the habit of washing your hands. And please stay out of trouble. Bye-bye. See you on Friday. And also, stay out of trouble. Bye-bye.